My name is Dr. Susie Lyons. I'm a colleague of Brian Galvin, and I'm very honoured to be here as part of this really interesting and important session today. And it's also really great still to be able to meet people in person and reconnect. That's as important as the, I would say, as the academic part of the day. So I'm very pleased to be able to welcome you to this second session of the National Drugs Forum today. And it's a very interesting session focusing on gender and really highlighting why we really need a greater focus on gender in this area of, in the area of drugs. And we're very lucky today to have two members of the European Group on Gender and Drugs, which is hosted by the EMCDDA. And our first speaker is Carine Mutatayi, and Carine is a scientific analyst for the French Monitoring Center on Drugs and Drug Addiction. She has a postgraduate in applied epidemiology and community health. She's a special focus on prevention issues, drug and gender issues, and critical social marketing. She reports annually to the EMCDDA on French drug prevention policies. She is involved in the methodological advocacy in scientific steering committees of prevention initiatives and reviewing for selected committees. She contributed to the 2022 handbook published by the Pompidou Group on the implementation of gender sensitivity, and her work was showcased earlier by our previous speaker. And as I said, she's a member of the European Group on Gender and Drugs. And this afternoon, she's going to talk about why does gender sensitivity in drug demand reduction matter, a focus on the challenges in drug prevention. Thank you, Carine.
Okay, it's all right. I'm trying not to spit too much in the micro. So I'm really pleased to be here today to open this session on how drug and gender issues may intersect. My purpose will be on prevention, on how why gender sensitivity matters in drug prevention. And my purpose, my presentation, as the presentation that Sarah Morton was intended to do, are directly linked to a handbook that was coordinated and published last June, in this June, and that was coordinated by the Pompidou Group. So I prepared some slides. Is it all right? Yeah. So I just inserted the first slide on my organization. It's a bit long, just to try to keep on time. I think that what we should have in mind is that this organization is a public non-profit organization with a scientific mission of describing and explaining the drug phenomenon in France for policymakers, practitioners, and also for the civil society. And just to say that the most important is that I have no economical interest to claim today. Okay, so gender sensitivity. First, when I will use drug, I will use drug as a generic word for all psychoactive substances, whether illicit or whether licit, in particular including alcohol. And drug sensitivity, so what it is, in a nutshell, it's to better consider what are the factors that may increase drug issues and the way they are tackled by drug policies. I would say that today, when gender is addressed by drug policy, it is essentially through the lens of pregnancy and motherhood. And when it is tackled by prevention policies, it is mostly focused on a kind of injunctive discourse to girls about their safety. But there is much more to be done under the whole range of drug demand reduction, from prevention to harm reduction and treatment, including in criminal justice response. when we are striving to have more equity, dignity, and efficacy in drug policies. And this is why the Pompidou Group decided, I think it was a bit more than 2 years ago, to gather a group of experts from 13 voluntary member states of the Council of Europe. You have the list in gray there on the screen, to trying to collect information to have a step forward in the implementation, the integration of a gender dimension in drug policies. So in practice, we were 5 main authors to draft this handbook, each focused on 2 or 3 parts of this document. And we received guidance and internal review from the other members of the work groups, plus external review from the MCDDA, the European Monitoring Center on Drugs and Drug Addiction, and from the Trans Equality Network. And this collaboration enable us to deliver evidence-based content, person-centered content, and also trans-inclusive content. So, this document is organized in 4 parts, a quite long introduction that reminds the rationale for better integrating gender sensitivity. It reminds also the multifactorial dimension of gender, bio, psycho, social, cultural dimension of gender. Then first chapter made a wrap-up of the available epidemiological, but also, as far as possible, sociological evidence about the phenomenon and about the way drug and gender intersect. And also made a wrap-up on the presence of the gender issue in drug policies. The second chapter tried to address the mechanisms that can be mobilized when we try to integrate this dimension in drug policies. And finally, the third chapter was more guidance for practitioners. This chapter was coordinated by Sarah Merton, who tackled more particularly the issue of treatment and harm reduction. I did for prevention, and Marie-Claire Van Hout for criminal justice responses. There is also a quite valuable glossary regarding all the gender-oriented notions, and there is quite a lot, and we also discovered that it was really important to make some things clearer, plus different examples that come up during our work about concrete experiences regarding this topic. So, today, there is a body of evidence that calls for better integrating gender dimension in policies. Surveys show that more men than women report to be using drugs. But when women use drugs, they are more severely affected by health, by physical, mental, social, and legal consequences. And they also progress more rapidly into drug-related disorders than men, and regarding those negative health impact. Also, I think that Ina, yes, Ina will talk about this. There is also a more rapid increase regarding the drug-related death among women compared to men. Regarding non-binary people who lack of data for non-binary people who defined themselves as being or fluctuating between or beyond the 2 categories of men and women. You see here a list of studies, but they are almost all that were carried out in the States, in the United States. So the available data show that non-binary people are at particular risk of experiences discrimination, violence, of using drugs, and of having suicidal thoughts. So, considering their specific needs and experience, women and non-binary people face considerable barriers in accessing to drug services, including, for instance, the fear of stigma, the fear of being stigmatized, the fear of being misunderstood by service providers. And structurally, this situation is likely to get worse for I would say, not a simple reason, but Sabrina told this morning that over the 10 last years, epidemiologists used to say that the gender gap is narrowing, the gender gap in drug use is narrowing, which is a quite nice way to say that it is not because boys are losing more like girls, but because more and more girls are using certain drugs, especially illicit drugs, and illicit drugs for current use. As you can see here, there are the graph that we already, figures that we already saw from the SPAD survey. So there are some girls are using more and more drugs, or the decline in prevalence rates is decreasing less rapidly than for boys over the years. And there is maybe an explication on that. Girls, just as women, are more and more involved in public life and social domains, and as a result, they have also a greater access to many drugs. So there is maybe a point here. But as Sabrina stressed it out, one obvious findings is coming up that obviously we are missing something in preventing drug use or certain substance use among teenagers, and more particularly among young girls. There is another crucial issue, which is adverse childhood experience, ACEs, because these ACEs are highly predict risk-taking later in life, especially drug use, and especially among women. And they are also highly predictive of violence perpetration, including gender-based violence, and of course of victimization. So, according to the general trend in general population, and also the precocity of the life event that may impact drug use, there is urgent need to take an action at an early stage and to have long-term responses. And this lies certainly in improving social policies, but also there is something that is more directly in our hands. It's to developing gender-sensitive prevention across the whole categories of prevention, universal, selective, and indicated prevention. And also to give a new impetus to research, because the recommendations we made in the handbook are evidence-based, but doing that work we also realized that further evidence was needed regarding relevant effective gender-sensitive ingredients for prevention, and also to update some operational components like protective and protective factors, and for instance the motivation of use. Why? Here you can see that box that was within the handbook, and that summarize some results. It is mostly based on the wonderful work that was done by UNICRI. UNICRI is the United Nations Interregional Crime Research Institute. Regarding protective factors, what we can see is that there are protective factors at the individual, family, and the social level. Regarding family bonding, child rearing, protective factors like pro-social peers, or risk factors like having non-breaking peers. Many of these factors are shared by boys, but family factors are particularly important for girls. And I would like to draw your attention to the two last one, which are, I can read it, but yes, better this way, which are traditionalist education, what is a nice way to say, some education model with a restrictive representation regarding the roles and the attitude which are assigned to female, and also the involvement in religious activities. And I stresses out that these two factors because as an educator, as a prevention professional, how could you build on such protective factors? Also, I would like to draw your attention on the years of these studies, because as you can say, they date back for 15 or maybe more years ago. And if we consider this, we can realize that most of these studies regarding protective factors were carried out and published before the advent, for instance, of social work. So this morning, Paul said that hyperconnectivity was a major trend for future research, and for instance, regarding the specific protective factors of girls, it is really, really important to renew, to refresh information regarding these protective factors, because we knew that drug use for teenagers are also involved in the socialization mechanisms, but we also knew that the new digital practice, social media and gaming are also very, very important. So how these two areas intersect and interact, I think it's really, really important to improve research on this topic. So research show that it is relevant to build on evidence-based psychoactive dynamics in prevention, and the rationale call for combining these psychosocial ingredients like normative education, life skill trainings, with gender-sensitive components. For instance, by drawing teenagers' attention on the weight of gender norms and gender-based drivers on consumption. Why? Because the gender norms, so the norms of masculinity and femininity, may heighten some specific vulnerabilities in boys, girls, and trans teenagers. And they may also foster shame and deter young people, teenagers, from seeking help in the appropriated help services. Also, it is important to draw attention on how drinking culture and the gender-based drivers may also stimulate domination behaviors, and then also stimulate some risk-taking and violence, or antisocial or even criminal behaviors like committing violence, and in particular gender-based violence. So, promising pathway to curb this issue is probably to promote solidarity across peer in prevention programs. Promote solidarity and show how to teenagers their key role and co-responsibility in preserving safety among peers, whatever their gender identity. This can be related with training, for instance, training young people to act as bystanders by staying among potential victim of violence or of drug abuse, by staying, close to him when the event is, when the situation is occurring. And this is a particular promising approach, for instance, in a selective prevention, in a recreational setting, and especially with a peer-based program. And this also comes with refuting rape supportive attitude like victim blaming for drug facilitated sexual assaults. For indicating prevention, research recommends to develop motivational approach which are based on personal resource to develop resilience. And I would say that one main conclusion of our work is also the need to base indicated prevention, which is a more individual approach towards very young drug users, to develop trauma-informed approach, especially especially towards girls and non-binary teenagers, considering their specific experience with adverse experiences. So finally, developing. No, it doesn't. No, what's happened? Come on. So here are the references. There is 2 slides. No, come on. What's happened? If I stay like that, it's all. Each presentation has this kind of issue. So, implementing, gender sensitivity in drug policy. It's part of a raising movement that is upcoming in Europe, and I would say in Western society. But it is still a very, very innovative approach, and we definitely need more research and more evaluation in this, on these topics. This means that we also need, maybe you will be able to see it, third, yes, we need champions and pioneers in this domain. To develop, gender sensitivity and prevention. Sorry, I'm a bit upset with all that. So I finish with the drug prevention.
Thank you. You've done really well on time. So you have maybe 3 or 4 minutes to talk about Sarah's work, and you're very sorry that Sarah couldn't be here.
Maybe there is another presentation on treatment. So Sarah coordinated the chapter for practitioners, and she developed more recommendations regarding treatment. As I told previously, there is a very complex and acute needs among women who use drugs with particular high risk of being dually diagnosed with a psychiatric comorbidity, depression, panic disorders. There are another structural issue is that women are more likely than men to cope with low incomes and to be also involved in complex financial situation, and for instance, sex for compensation, which is not exactly prostitution, but I won't develop. And they are more likely to cope with violence experiences. So, resulting from this particular risk, we observe that the women are more likely than men to have cyclical use of services with a lot of relapse and re-entries into the system. And those relapse and re-entries are particularly prompted by disruptive and traumatic events that are more frequent, that are particularly frequent among women who use drugs. For instance, the release from residential treatment, psychiatric hospital, prisons, child removal, separation with the partners, migration, violent experiences, including, of course, war and conflict experiences, and assaults. And as a result of that, particular low rates of women we have low rates of women accessing to drug services and completing also treatment compared to the proportion of women who use drugs. And women who use drugs often present to drug services at very, very critical point with very complex needs and aggravated physical and mental health. So these data suggest that there have, of course, really significant barriers in accessing to drugs. That could be listed here, a lack of knowledge of available services, and this lack of knowledge is also observed among common law services, health services, who don't know where women can be referred to. Negative experience with past experience with service providers, psychological barriers, including the fear of abusive partners, who may disagree with the interference from service providers. Also, among these barriers, there are exclusion criteria of the services. For instance, when people show antisocial behavior or when they are active drug users, it can be an exclusion criteria. There are long waiting lists and also an overburden of services. Safety, all those factors, barriers can be shared by men, but they are more particularly salient among women. Safety concern as well. Safety concern from also male clients of the service, particularly when women are accompanied with children. And there are additional challenges for foreign or migrant women and also for non-binary drug users. So the challenge for treatment and harm reduction services can be also listed as it's shown on this line. First would be to enhance trust in the practitioners and service providers. To improve the safety issue, for instance, by developing or proposing women-only slot times, days, or women-only arrears within the services to enable to engage more with more safety into the relation with service professionals. To address also structural inequalities by supporting the development of training, financial and life skill domestic trainings, improving self-esteem and efficacy. In France, we are talking about narcissization. It's a horrible word in French. I guess it's also the same in English. It's a lot of workshops that can be proposed to women, like socio-aesthetic and a cultural event to develop more self-confidence, to also help women to refocus on time bounding, because for women who use drugs, time has become an distended notion, and just to be able just to focus to an appointment, to a specific activities, it's also a kind of low threshold approach. Also to consider immediacy with speedy access or with urgent provision, for instance, of hygiene stuff, food, nutrition, second-hand clothes, and also to favor seamless referrals, for instance, with dedicated professionals to the specific situation of a woman who use drugs. So, and again, there is an important need to develop research. Thank you.
Thank you very much, Carine. I think we can all agree that this the new handbook, which has been published by the Pompidou Group and the Council on Europe, is going to be a great help for us in the future to inform our work and our research going on.